Welcome back. This next session will be a panel of very dynamic speakers who will discuss how to be your own advocate. I'm pleased to welcome Dr. Andrew Ewa from the Glaucoma Center of San Francisco and Dr. Michael Halkias from Naper Grove Vision Care. We have also invited a patient to join in the discussion. Please welcome Linda Richardson. She's an Anglican priest and a retired speech and language pathologist who worked with autistic children. Dr. Halkias, I'll ask you the first question. What advice do you have for a newly diagnosed patient?
Thank you, Ruth. A new diagnosis can be quite scary for a new patient. So getting the facts, getting all the information, asking questions, very important.
Great. I'm going to ask Reverend Richardson the exact same question. What advice do you have for a newly diagnosed glaucoma patient?
Well, when I was newly diagnosed, I immediately thought of my mother because she had had glaucoma, and I wished I could have talked to her, but she was no longer with us. So I didn't know what to do, but I did have the knowledge that I wasn't going to go blind immediately. But I did ask lots of questions of the ophthalmologist that I was seeing. You said at one point in our discussion here, take a step back, and I would say take a deep breath. And just before you plunge in and try to read everything, just take a deep breath. If you know someone that has glaucoma, maybe ask them a few questions.
Well, maybe I can ask you a follow-up question. What do you recommend to a glaucoma patient about how to be proactive about his or her care?
Well, you know, as I was thinking about you're asking me to do this today, I thought, you don't know me very well. I don't think I've been very proactive. But I read, and no one paid me to say this, I read on the website, glaucoma.org, all the wonderful information. I would have sent somebody directly to that website. It's not scary. It's informative. Any question you have is answered right there.
And after today, you'll be able to go on the website and see yourself there.
Oh, dear.
So, Dr. Ewa, glaucoma patients sometimes see a glaucoma specialist. So when should a patient be seeing a glaucoma specialist?
Well, it really depends on the situation. And in general, we can preserve patients' vision. In general, we have time. We have time to collect data and to get a better understanding of the situation. So I think that in those early phases, when one gets the diagnosis, take a deep breath, odds are in your favor, things are going to be okay. Collect the information, and then as you learn more about the disease, and the Glaucoma Research Foundation is really one of the best resources, then you can figure out your comfort level. And it should be there, because this is a chronic disease. You'll be dealing with it to some degree over time. And if there are any questions, then if even the thought of maybe getting a second opinion comes up, you should do it. And just to make sure that you're comfortable, and most eye care professionals, we're used to that. That's okay, because we all are working together to help patients maintain their vision. So we work as a team.
So one of the important things about taking care of your glaucoma, if you're a patient on eye drops, is to take the drops regularly. We all know that's harder to do than it sounds. So Dr. Halkias and Dr. Ewa, what tips do you have for patients to take their medications faithfully and really follow up on what the physician is asking you to do?
This is an important one. I like to have my patients memorize their drops. A lot of times I have them look at the bottle, memorize the cap color. Is it blue? Is it yellow? I show them exactly how to put the drops in. A lot of times people, you think it's an easy thing to do. Put eye drops in at bedtime, put eye drops in the morning. It is more difficult if you're not a contact lens wearer. What I do is I show the patient exactly the technique. I review it with them, and then I give them my cell phone number. I tell them, if you have any questions, text me. I'd be happy to show you how to do it. The other thing is there's a lot of valuable resources on YouTube. also on different websites, academy websites. I just want to make sure that they are comfortable with the process. A lot of times I have them repeat it back to me. What did I say? Was it morning to night? Was it just at bedtime? If they memorize exactly what they're taking, it's going to make it more easy at their follow-ups to do what they were supposed to do. You'd be surprised. A lot of people, they think they know it, and then they go home and they forget. So review and memorize.
Dr. Yuo, would you add anything to that?
Yeah, I think that this is a long-term treatment plan. And whenever possible, I try to make it as user-friendly. So that is to say, if we say take it once a day or twice a day, link it to some other activity, whether it's in the morning or even just before you go to sleep. And with regards to how to actually take the drops, I agree it's useful. If there are any questions, I certainly would encourage the patient to ask in the office. But a couple of simple things. If the patients they just can't get a drop in, one simple trick is if you lay flat in bed, you close your eyes, you put the drop right in the inside corner. As you open your eyes, the drop rolls in. So anyone can get a drop in, number one. And number two is, there are different ways to try to maximize the effect and so forth. But another simple way is just to gently close your eyes after you put the drop in. No need to put any pressure. And by just keeping your eyes gently closed, that will maximize the effect of the drop and minimize the side effects. And those type of little tricks as you kind of talk to them, and that's part of our job when we see our patients is to, okay, we gave them a treatment plan, but is it working? Can they live with it for a long time? And that's part of the fun of helping patients with glaucoma.
So one of the problems, go ahead.
I'm sorry, I would like to add too, it's so important to treat each patient it's a choose your own adventure. It's not a one size fit all. Every single patient has a different circuitous route. It's a very insipidous disease that, it's slow and it attacks, but we have an arsenal of tools. We've got drops, we've got surgery, we've got so many things that can combat this disease. So
it's easy for us to prescribe the medications and harder to take it, but another barrier are the cost of medications. So do you have any advice to patients about how to get lower cost medications?
I would like to say that our office has been very good at this. We take the patient under our wings. Every prescription that we write, it's almost a foregone conclusion that we're going to get a prior authorization fax within minutes. We're going to get a call from the pharmacy saying there's an alternative drop that's cheaper. I will tell you that we are very good at battling on the patient's behalf. There's GoodRx. For patients that are under 65 that are not on Medicare yet, there are definitely some coupons that each one of the reps brings by, Allergan, Alcon, they all have coupons. When they get to Medicare, it's a little harder. We think first and foremost, is this therapy going to work? Is it going to have side effects, and is it going to be cost effective? Those three things have to work for the patient.
Yeah,
Dr. Yuwa? Yeah.
I was going to say, I think that's a really, really important discussion to have with patients. And sometimes they're a little bit shocked to tell you that, what they can. In fact, you hear all types of stories in your practice. One patient thought, well, you know what, I'm going to treat my heart one month and my eyes the next month. That's not a good plan. And so there are different options in each different family of medication, in almost every family. So we can look at different alternatives. Certain insurance companies will favor one medication one year or another. So it is a bit of an active process working with the patient. But then the other question is depending on the state of the disease, maybe we should look at other options than medications. Maybe we should look at a laser treatment, or if they have a cataract and maybe they've been thinking about cataract surgery, we have some really elegant surgeries now where we can help with the cataract, maybe also address the glaucoma and reduce the burden of medication. So this is the fun part of customizing, trying to figure out what's the best fit for every patient. And that changes with time. Their picture changes. So it's a dynamic interaction. And again, the key is to empower the patient, speak up, ask questions. If something doesn't feel right, don't assume it's not your eye drop, because it might be.
I would like to add too that it's difficult for patients to understand cost. It's think about even for us, sometimes we have the patient come back and they've met their deductible and the drops are inexpensive. And then, the year turns into the next year and it's January and they're ready to get their medicine and they wonder why the medicine has tripled. So it's an ongoing effort with the optometrist or the ophthalmologist and the patient and the team that's supporting this patient through the process to get price, upfront, because it is important. It's part of the process.
So Dr. Ewai, you mentioned some of the elegant new surgeries we have. I think it can be a little overwhelming for patients with, the multiple minimally invasive glaucoma surgeries that we call MIGS, all the choices, and, the choices come and go. What was available a few years ago, we're not doing now. So how do you guide people through all those choices?
The decision to do surgery is a big one. And so it requires that we go over the options with the patient. And in general, the basic principle is to, first of all, try not to do any harm. Try to choose procedures that are less likely. Unfortunately, every surgery has some potential risk, but we can look at what the needs are. There are different approaches, and these are constantly being evaluated. And as we get more data, and that's a very personal discussion with each patient. And you have to set the time aside. And I encourage patients, after I first discuss possibly having surgery, whenever possible, I want to meet with them one more time. And I encourage them to take that interval to read up, to write down their questions. So when they come in, they are prepared. And it's really important with surgery, especially with glaucoma. It's different than cataract surgery. If they talk to their friends who've had cataract surgery, often in a few days, they're off and running and playing golf and whatever. Glaucoma surgery can be different. The recovery can take a bit longer. The number of visits can be greater. And so it's really important as a surgeon to inform them of that, to prepare them for that, so that if in fact that does happen, it's not a surprise and they don't get scared.
So Reverend Richardson, I have a question for you about how you talk about glaucoma to your family or your friends when they ask you about it. What do you tell them?
I come from a glaucoma family. Not only did my mother have it, but my husband has it. And my oldest son also has it. And so my oldest son refuses to talk about it, which is an issue. But in terms of my friends, honestly, to be perfectly honest, I don't talk about it very much. People don't ask. They don't seem to wonder. And if I'm going to talk about it, I had one friend who had glaucoma, and so we discussed that. Well, what drops are you on, and how do you remember, and those sorts of things. But at the moment, I don't really have anyone to talk to except my husband.
I think that's a really important point. People tend not to talk about glaucoma. Sometimes that your mother had glaucoma, but sometimes people will come in and be newly diagnosed and they discover that their mother or another family member had glaucoma and they didn't know about it. So I think one of the beautiful things about a patient forum like this, about talking about it, is that we're a whole community of people with either treating glaucoma or patients with glaucoma. And it's very comforting to know that there are so many others out there. And so I think GRF provides that community of people with like issues. So I was very interested to hear you say that.
Yeah, well, I think comforting is a good word. As I watched some of the videos and so forth on the website, I felt comforted, these people are living with the same thing. They understand. And yeah.
I was just going to mention, one of the most effective ways of screening for glaucoma is talking to your family. Now, when the holidays come up, sometimes you don't know what to talk about. And so why not talk about your eyes? Give the gift of sight and say, you know what? I just want to make sure I have glaucoma. And, that means is because we're relatives, you may have it. So make sure that you get your eyes checked. And oftentimes patients think, oh, everything's fine. I can see all well. But as you well know, unfortunately, glaucoma can affect the side vision. Patients have no clue. That's why we call it the thief of vision. And so at the holidays, give the gift of sight. Mention it to them.
People also are more comforted when they know they didn't do anything wrong. They think, did I eat the right foods? Did I take the right vitamins? What did I do wrong? You can't change your genetics. And so I try to highlight the positives. I say, for at least the one family of initial therapies, your lashes are going to grow longer. I try to highlight the positives. So try to spin it in a positive way, educate.
Yes. I think that's great. Educate, educate. I like to tell my patients, I want you to learn something every time you come in to see me. And over time, you'll have a PhD in glaucoma. And the other exciting thing is that we really are unlocking some of the genetic codes of glaucoma and understanding it. There were just last year, we discovered quite a few new gene loci. So we're starting to figure this out. And another generation from now, I think we'll have a much deeper understanding of how genetics interplays with the disease. So it's a little exciting. Well, I am really enjoyed this panel. I learned a little bit. Each of you has something valuable to say. And most importantly, I think we shared our experiences with the other glaucoma patients. So thank you, each of you.
Thank you.
Thank you.
That was extremely insightful. Thank you all for participating and sharing your advice and suggestions.